I need to address today's Auditor General's report. Folks, I welcome scrutiny. I've stood here and taken questions every single day. But the reality is that between the Minister of Health and the Minister of Long-Term Care, 2,744 work hours, I'm going to repeat that, 2,744 work hours, well over a year of work, was taken away from our efforts to fight COVID-19 to support the Auditor General in this report. And ultimately, I have some serious problems with this report. To say that Dr. Williams wasn't leading this response, it just isn't right. It's actually wrong. This does nothing but undermine our entire health team. And I can't stand for this. And I'll tell you, I won't stand for this. My friends, ultimately, as your elected premier, the buck stops with me. But Dr. Williams has been riding shotgun with me from day one. There's no daylight, and I'm going to repeat this, no daylight between us. In every decision we have made, every step of the way, the health team, Dr. Williams, has guided us from day one. They have led us throughout this pandemic. For their help and support, I'm extremely grateful. They work around the clock, right around the clock, for 9 months straight without taking a single break. These are people who put everything they have into guiding us through an impossible situation, an unprecedented crisis. And we owe them a debt of gratitude. For the Auditor General to undermine them right now as they work morning, noon, and night to get us through the second wave, I have to question that. My friends, from the outset of this pandemic, we have moved at rapid speed. We have broken down silos. Our entire government has been working together. Every single ministry has been working together to tackle this pandemic. And the results speak for themselves. Ontario has the lowest rate of active COVID-19 cases among all provinces outside of Atlantic Canada. At 89 cases per 100,000 people. Compare that to other provinces. Ontario, 89 cases. Quebec, 128 cases. British Columbia, that was in this report. Ontario, 89 cases. British Columbia, 165 cases per 100,000. Ontario, 89 cases. Saskatchewan, 249 cases per 100,000. Alberta, Ontario, 89 cases. Alberta, 305 cases per 100,000. Or we see in Manitoba, 634 cases per 100,000 in Manitoba. In fact, outside of Atlantic Canada and the territories, Ontario has the lowest rate of active COVID-19 cases per 100,000 anywhere in North America. Not Canada, anywhere in North America. Well, no government is perfect. We can all be proud of our heroes, our doctors, starting with Dr. Williams and his team, our nurses, our frontline workers, everyone who has played a part in this. And I want to thank them